Welcome back to my channel. So today I have come with a new topic for you on melasma. So this is a skin disorder that can happen in few people. So let me give you more insights about this particular skin disorder today. So it's a skin condition where there will be patches on your skin. So basically these patches can be brown or they can even be bluish gray patches. So most of the time melasma is thing that it comes as pregnancy happens. Okay, most of the people have this issue. So basically it is more predominant in women compared to male candidates, and pregnancy can be one reason because during pregnancy there's a lot of hormonal changes that happen in you that can lead to this condition. So usually the parts of the body that is infected by this melasma is your cheeks, chin, nose bridge, forehead, upper lip. So these are the main regions in your face which can get exposed to this condition. And as I told you, pregnancy is one reason for this. And apart from this, if people are taking a lot of oral contraceptives, that also can be a reason for melasma. So one major reason for this is exposure to sunlight, because we know we have melanocytes in our body. These are the cells which produce a pigment called as melanin, which gives brown color to our skin. So what happens is exposure to sunlight, so extreme conditions, can lead to damage to these melanocytes. And as these melanocytes gets damaged, they start overproducing melanin. So that is why it leads to more brown pigmentation in the skin. So that can run through families also. Like if you have a family member with this issue, through genetics, it can run into you also. Identical twins also, they have seen some cases where both of them have these issues. So there are few genetic issues also which can be triggering. Apart from that, free radicals, so UV exposure, basically radiations of the sun, so that can lead to lipid peroxidation. So in your cell there can be some damage which can lead to a lot of free radical formation, and these free radicals can in turn stimulate your melanocytes. So in the skin we have melanocytes. Because of these free radicals, it can stimulate the melanocytes to produce excess melanin, which gives more and more brown coloration. So that can lead to a condition called as melasma, which can be very difficult for people because too much dark pigmentation can happen in the face and that may not be comfortable with them. So coming to the causes, as I told you, it can be genetic, it can be because of sunlight, that is UV radiation. Certain times hormonal influence like improper hormonal balance in you also can lead to melasma. They've also seen that thyroid diseases, so those are facing issues with thyroid issues, so those are also prone to melasma. So they become self-conscious. So effects are that self-conscious, anxiety also can be there because they are getting this pigmentation, they cannot take it, so they can become very anxious. They can even end up with depression, and we already saw how pregnancy also can lead to this condition. So sleep deprivation is also one cause for this particular situation. So stressed life, no sleep can lead to a lot of imbalance in you, basically hormonal imbalance, that can in turn lead to melasma. So coming to the risk factors, so sensitivity to the hormones, basically estrogen and progesterone. So these are the main hormones which are there in females. So basically sensitivity of these hormones can lead to melasma. So lot of birth control pills if you are taking, so that can lead indirect effect or side effect of that can be melasma. And apart from that, sleep deprivation I already spoke about, thyroid I already spoke about. Apart from that, definitely genetics. So these are the few risk factors that may be the reason for this particular condition. So coming to the potential triggers, so hormonal changes during pregnancy, so that I already spoke about. Apart from that, if you are using a lot of skincare products, certain times your skin might get irritated because of the skincare product that you're using. So you should be very careful when you're using any skincare product. Always try to see that you don't use any local brands which are not having proper scientific things. So see to it that you don't compromise on the quality of the skincare products that you're using, because in turn if the irritation happens to you, that can in turn lead to melasma, which can be more complicated. So you need to take very much care about skincare products in case you're using it. Apart from that, certain times they've seen that medications, basically anti-seizure type of medications, retinoids, and any medication if you're taking for blood pressure, they've seen that side effect of that can be melasma. So these are few potential triggers. I'm not telling that these will lead to melasma in everyone, just that some people will be very sensitive. So for those people, these potential triggers can end up with melasma. So coming to the mechanism, how exactly melasma happens. So we'll understand the skin layers. So I've already spoken about these skin layers previously in my lectures. So these are the dermis and epidermis layers, and these are the melanocytes which will secrete a pigment called as melanin, which gives brown coloration to our skin. So what happens is, in this particular condition, UV radiations basically can lead to damage to the melanocytes, and once these cells are damaged, they become overactive or something like that. Okay, so they start over producing this melanin, which can lead to a lot of pigmentation. So that is what is melanocyte problem here, overproduction, and that is called as melasma. Apart from that, they have already seen that certain inflammatory pathway analysis has been done, and they've seen that people suffering from this melasma, they have more immune cells in their body compared to normal people. So this happens because of sleep deprivation in some people, which can lead to a lot of hormonal imbalance, which can lead to melasma. So this is just to show you the layers of the skin and melanocytes overproducing melanin, which is leading to pigmentation in the skin. So coming to preventive measures, so sunscreen can help you to some extent. So sunscreens which have sun protection factor more than 50, so see to it that you use these kind of sunscreen products. So you can apply it in the morning, again you can apply it in the noon. So regular application of the sunscreen would be recommended, and there are even sunscreens which are available with iron oxide. So this is also a good product because it blocks the natural light more than the white sunscreen. So this also has good benefits. So you can prevent melasma basically using these kind of sunscreen products. Coming to the diagnostic options. So basically dermatologist can help you with this particular condition. So they might do a visual examination where they observe the brown pigmentation in your skin. Apart from that, they have certain equipments with them called as dermatoscope, something like a microscope, which is used for skin. So that is why the name dermatoscope. So they use that dermatoscope. This is just to show you that how they observe it. Using that, they can just observe if there is any infection, like bacterial or fungal infection, and how many layers of the skin are getting affected. Even that they can find out. So apart from that, even certain times they even do a skin biopsy to see the melanin deposition in the skin. And this is something like a UV chamber or a fluorescence where they can observe. So if the hand or any area is infected by this melasma, they can observe it under this light. So this is just to show you that you can see under normal condition when they observe, it may not be very evident like which areas are mostly infected or melasma affected area. But here you can see in this chamber where they have exposed to light, you can see the exact location where this is affected. So this will become more clear. So these kind of techniques basically dermatologists will use to identify the area, so they can plan exactly what further treatment they can plan. Okay, for that particular reason they have these kind of diagnostic options. So this is just to show you how melasma can look like. So as I told you, cheeks, upper lip, nose bridge. So these are the usual areas which can get affected by this particular condition. So is it treatable? So this is one question that can come to our mind. So certain times what happens is, to many of the people this disappears on its own. Okay, because due to hormonal imbalance it might have happened, and once your hormones becomes normal, there is a chance that this basically melanocytes stop overproducing melanin, and that can lead to decreased melasma condition. So lightening, apart from that there are certain cosmetic procedures like chemical peel and dermabrasion and some other techniques which are recommended only with the help of concerned people like dermatologists. So you should not go to somebody else who is doing this. Just recommend you to go to dermatologists because they know the exact procedure how to use it, and hope that doesn't cause any problems. Okay, because you're going to treat yourself from melasma, and if that can lead to further triggering of melasma, that can be detrimental. So they even use something called as intense pulsed light. So using the light therapy also dermatologists can reduce the melasma in you. So sunscreens we already spoke about, like sunscreens which contain zinc oxide, titanium oxide or iron oxide can be used. So this is basically to prevent further melasma happening. It's not like once you have melasma you use sunscreen, it will stop. It is not like that. Just that further melasma formation can be reduced once you apply sunscreen. So certain topical medications like tretinoin and mild corticosteroid, azelaic acid, kozic acid. So these are few things which will be recommended by dermatologist based on the requirement. So it's better to consult the dermatologist, meet them and check your condition, and then only take the specific ointments or whatever they suggest, or maybe some treatments or ointments. So coming to the takeaway messages, we have seen that it's better to understand the issue, like what's happening, why the melasma is happening. So once you understand that, it will be better. Apart from that, there are some support groups available. So if you're comfortable joining those support groups, it's better you join those groups so that people having the similar issues, they will discuss and you will feel better, because most of the time we have seen that people having this issue of melasma, they have a poor quality of life. And they have a lot of psychological issues because of the pigmentation in them. They feel that they're not looking good, too much pigmentation is there, what will people think about them? So these kind of issues are there which are psychological. So that is why if you join certain support groups, that might be helpful. So regular consultation, basically if you are following dermatologist for some treatment, regular follow-up with them will be very, very essential. So there are few new treatment options which are coming up, like basically they have seen that melasma is associated with inflammation and skin barrier breakdown. So your skin barrier is broken down, and once this is broken down, it increases the blood vessels in you. So some research has been happening in this area, which will be like a plus point for treatment of melasma. So you should keep in mind that you need to understand the issue that you are having, so that once you understand the problem, then only you can think about how to solve the issue. So please don't forget to take care of yourself. So these are the references which I used for making this PPT for you. So thank you for watching. Do like this video if you feel this is worth liking. Subscribe to my channel and please share this video with maximum people so that I can make much more educational videos for you like this. Thank you for your support till date. Have a nice day.